Hello friends, welcome to All About Medico. Myself Kriya Sharir, today's student, and here we will discuss ECG. It means electrocardiogram. On a electrocardiogram means is a graphical record of electrical activities of heart. Okay, electrical activities of all cardiac muscle fibers recorded from body surface in ECG means ECG मशीनला आपण इलेक्ट्रोकार्डिओग्राफ म्हणतो आणि जो ग्राफिकल लेवल असतो त्याला इलेक्ट्रोकार्डिओग्राम असे म्हणतात. ओके, आणि ECG मशीन थ्रू आपण ऑन बॉडी सरफेस we can detect the curve of cardiac muscle recorded electrical activities of curve. Okay, what are the importance of ECG? To determine or diagnose the heart rhythm, ischemia, heart attack, coronary artery disease, to determine heart rhythm, diagnose abnormal electrical conduction, heart attack, diagnosis of heart attack, coronary artery disease, hypertrophy of heart chamber, left or right ventricular hypertrophy. We can diagnose by ECG, ischemia, decrease of blood flow, heart. These are diagnosed or determined by ECG. Okay, in ECG there are two limbs, unipolar and bipolar limbs. ECG have two limbs, unipolar and bipolar limbs. Limbs means it is a basic series of electrodes on body surface. It is a placing on body surface to record electrical activity of heart. Limbs can unipolar and bipolar limbs. These leads placed on these electrodes are placed on body surface to record the electrical activity of heart. And these leads are connected to the ECG machines, means electrocardiograph machine. And record is also called as electrocardiogram. Bipolar leads. Bipolar leads are also called as standard limb leads. And bipolar leads are of three types, which are lead 1, lead 2, lead 3. Lead 1 is connected to the right arm and left arm. Lead 2 is connected to the lead first. Lead first is connected to the right arm and left arm. Lead second is connected to the right arm and left leg. Okay, and lead third is connected to the left leg and left arm. Okay, lead 1 connected to the right arm and left arm. Lead second connected to the right arm and left leg. Lead third connected to the left arm and left leg. These are bipolar leads. Lead 1, lead 2, lead 3. These are the bipolar leads. These are standard limb leads. And then unipolar leads. Unipolar leads, which are unipolar leads? These are two types of unipolar leads: chest lead and limb lead. Chest lead unipolar leads, limb lead unipolar leads. In limb leads, unipolar limb leads. These are AVR lead, AVL lead, and AVF lead. AVR lead, AVL lead, and AVF lead. In AVR lead, active electrodes are connected to the right arm. In AVL lead, active electrodes are connected to the left arm. And AVF lead, the active electrodes are connected to the left leg. Okay. So discuss ECG, electrocardiogram. In ECG, there are P wave, device complex, and P wave. P wave signifies depolarization of atrial muscles. P wave signifies depolarization of atrial muscles. Means atrial contraction of atrium. Due to contraction of atrium. It is the first positive wave. Second last positive wave is the P wave. P wave is the negative wave. RO is also positive wave. And yes segment is a negative segment. Okay. Its duration is 0.1 second and amplitude is 0.1 to 0.12 MV. Duration 0.1 second. Duration of P wave 0.1 second. Amplitude of P wave 0.1 to 0.12 MV. Then QRS complex. QRS complex is a depolarization of ventricles due to QRS complex because of contraction of ventricle, right and left ventricle. Okay. Depolarization of contraction of ventricle. Depolarization of ventricular muscles. Depolarization of ventricular muscles. P wave due to depolarization of atrial muscles. It means due to contraction of atria. QRS complex due to contraction of ventricle. It means depolarization of ventricular muscles. And its duration is 0.08 to 0.1 second. Duration of QRS complex 0.08 to 0.1 second and amplitude is 0.1 to 1 MV. Okay. And Q wave. Q wave due to electrical activity of interventricular septum. Q wave due to electrical activity in interventricular septum. And R wave due to right ventricular contraction. R wave due to right ventricular contraction and S wave due to left ventricular contraction. Okay. During QRS complex, atrial relaxation also commits. Means during QRS complex, ventricular contraction also and atrial relaxation also begins. Okay. That's why U wave and S wave is negative. P wave. P wave it is due to repolarization of ventricles. Repolarization of atrium occurring QRS complex. Repolarization of ventricles occurring P wave. Repolarization of ventricular muscles. Means ventricular muscles are relaxing. Okay. Its duration is 0.2 seconds and amplitude is 0.3 mm. Duration is 0.2 seconds. And amplitude is 0.3 mm. Okay. In P wave, depolarization of atrium means atrial contraction. In QRS complex, depolarization of ventricles means ventricular contraction. In P wave, repolarization of ventricles means relaxation of ventricular activity and relaxation of atrium activity in QRS complex. During QRS complex, contraction of ventricle and relaxation of atrium both are occurring. Take this during QRS complex. And PR interval. PR interval signifies atrial depolarization and conduction. It signifies atrial depolarization and conduction. PRU is one set of P wave and Q at the end of Q wave. At the end of Q wave. PR segment. This is the PR interval. In PR interval, atrial depolarization and conduction. This is the PR interval, atrial depolarization means atrial contraction and conduction of impulse through AV node. Conduction of impulse through AV node. Duration is 0.18 seconds. QT interval. QT interval means which of the difference from this to this. From this to this. QT interval. In QT interval signifies ventricular depolarization and repolarization. In QT interval, ventricular depolarization and repolarization. Ventricular depolarization and repolarization means ventricular contraction and ventricular relaxation are occurring in QT interval. In QR interval, atrial depolarization means atrial contraction are occurring. Okay. It indicates electrical activity in ventricles. QT interval indicates electrical activity in ventricles. PR segment. PR interval indicates electrical activity in atrium. QT segment indicates electrical activity in ventricles. Duration is 0.4 seconds. Okay. RR interval. RR interval means From this R equal to the next consecutive R. From time interval between two consecutive R. From next R from this to next consecutive R is called RR interval, and it signifies duration of cardiac cycle. RR interval signifies duration of cardiac cycle, and it helps in calculate heart rate. It helps in calculate heart rate, and its duration is 0.8 seconds. The duration of RR interval is normally 0.8 seconds, and RR interval helps in calculate heart rate and cardiac cycle. Okay. Here we will discuss ECG, means electrocardiogram, graphical record of electrical activities of cardiac muscle. Okay. Thank you. Best of luck.